Hi guys, I'm back and today we're going to talk about the treatment for postnatal depression. And I know a lot of you out there might be nervous watching these videos thinking, do I have it, have I got it? But that's absolutely fine. If you have it, you have it. But you can get through it, honestly. We will get through it together. So today in this video I'm going to talk to you a little bit about treatment for postnatal depression. Now if you have got postnatal depression, please don't worry too much, okay? Because the more you obsess and worry over things, the worse it can get. So today we're going to look up treatments. I've been scouring on the net to have a look at treatment for it. Well, actually, let me just read out the treatment. So we've got talk to your partner. If you've got a partner out there, just speak to them about it, because if you don't talk to anyone about it, you're gonna be constantly. It'll only get worse. Basically, it'll just get worse. But if you haven't got a partner, talk to your friends or talk to your family and get them to try and understand what you're feeling, because at the end of the day you need support. If you've got something as serious as this, you need support. And the first step, even if it's talking to someone on the internet. I mean, what I did, I downloaded an app called 7 Cups. It's to do with anxiety and depression, stuff like that, and that's what I did. And that's a good start to do that. Right, and this is a big one. Do not, whatever you do, try to be a super mum. Don't think that you can basically accept help from others, because if you don't accept help from others, then it's going to get worse. But let's make light of it. Right, accept help from others when it's offered and ask your loved ones if they can help look after the baby and do tasks such as housework, cooking and shopping, because I guarantee you, no matter how fast your legs might be or how quick your reflexing might be, you won't be able to do all of it. Because if you wear your body out to the full max and your brain's still going, then just don't do it. My advice to you guys is don't do it, because I tried it and it's no good. It really isn't. You've got to try, and this one's a hard one, especially if you're a single mum out there. Make time for yourself, even if you get a babysitter to come round and look after your children. If you've got children, more than one. If you've got just one child, just try and make time for yourself, because if you don't, then you'll be stuck in this vicious cycle constantly. And every mum needs a little bit. Like, my time to myself would be me doing these channels. That's my downtime, and having a nice cup of tea. Even if you sit down and read a book, watch your favourite show, anything like that, anything just to have a bit of downtime. Like, even if you like going for a walk, why don't you try going for a walk, or listening to music while you're jogging, having a warm bath, have a candlelit bath, stuff it. If it was me, I would. Right, this is the next one. Rest when you can. Although it can be difficult when you're looking after a baby, because it is very, very difficult. If you are a mum out there, then you understand it is difficult. I know that, you know that. But you've got to try and rest, even if it's little rest stops, respites, like me, like sat here now. Just stop and rest for a little bit. It says here as well, try to sleep whenever you get the chance. Again, single mums out there, it is hard for you to rest and get cat naps, because I'm not being funny. You get a lot of people out there that say, oh, just sleep when they sleep. Now, my opinion on this one, it's just my opinion, you can't, because by the time you're trying to fall asleep, the baby's woke up again. Exactly. So what I'm going to say to you is, just, even if you ask a neighbour, ask your mum, your dad, your auntie, you know, your brother, your sister, just say, can you have a baby for a couple of hours while I have a kip? Just do it, because at the end of the day, you are not super mum. You can't do it. You can't keep literally being on the go 24/7. You can't do it. You need to sleep, because sleep is one of the most important things that you need, is sleep. Sleep whenever you can, but because, to be fair, a good sleeping habit, it'll help your brain function better. Right, we've got another one here. Exercise regularly. This has been shown to help boost mood in people with mild depression. Exercise, whether it's a couple of squats, I don't know, walk down the street like that. Literally, just go for a walk. Or, I don't know, if you like doing weights, like I've started to get into weights. I know, tell me about it. Check my muscles out. Check them bad boys out. No, but try to exercise, literally, whether it's a rowing machine, go a bit of swimming, have a bit of that going straight in my basket. Try doing that. Eat regular as well, and I know you guys out there, if you're a mum, you will, I'm guessing, hardly have time to eat. I know that feeling, but you make the time, because if you don't make the time, you can end up losing so much weight. Because just think, you're rushing around after your baby constantly, and your weight is decreasing, and you're not getting enough food in you. And I heard this as a tip from someone I once bumped into. She said to me, if you don't feel hungry, have a shot of sherry. If obviously that could help. You've got to, you know, have a shot of sherry. That'll help you eat. It'll make you hungry. And if you genuinely feel like you are losing too much weight, please go and see a psychiatrist, or just someone. Even if you don't want to see a psychiatrist, that's fine too. Just talk to a friend. But you need to make sure you eat well, because if you don't, you won't have the energy, you won't be able to look after your baby. Your body won't let you. Okay, so please do that. It says don't drink alcohol or take drugs, this can make you feel worse. Right, my opinion of that to you guys is, if you want to have a drink, go and have a drink. If that's your wind down, then you do it. That is entirely your choice, please understand that. But if, obviously with take drugs, I say don't take drugs. Drugs are not the way to do it, especially if you have a baby. Just stay away from drugs. But again, that's your decision, guys. If you want to do that, that's up to you. But I will say, what they could do is put you on medication. And I know a lot of you out there think, oh, I don't want to go on medication, but it will help, honestly. Because I'm now on medication, and it's the right medication as well. And it's really helped me. It's helped me function every day better. It's got me hungry and things like that. Right, guys, now we're going to look at these ones. Psychological treatments. Psychological therapies are usually the first treatment recommended for women with postnatal depression. And that must sound scary, I'll bet. Because to me it sounds a little bit scary. Here it says, get a guided self-help involves working through a book or an online course on your own, or with some help from a therapist. Me personally, I'm going to say no. Don't do a course, because the more you obsess over what you've got, the more it will get to you each day. You've just got to kind of picture your mental illness as as a friend told me, a thing. Like, picture it's a thing there, even it could be a dark cloud, picture it as a red cloud, picture it as a spoon, I don't know, picture it as a spoon. Each time you feel that postnatal depression kicking in, use your head to push it out. Say, right, I'm pushing this out today, I'm going to push it out my head. And then just keep doing it, just push it out. Keep yourself busy. Like, if you just think about other things, just try your hardest, honestly. They are cognitive behavioural therapy. Now, this can be good. Cognitive behavioural, I did do it once. It says here, this is a type of therapy based on the idea that unhelpful and unrealistic things leads to negative behaviour, and yeah, it can lead to negative behaviour, I won't lie to you guys. But not everyone needs to do a CBT course. Just look up videos, you know, like I've said to you guys, why don't you I don't know, just keep your mind active all the time. Try not to think about postnatal depression. Don't let it overtake your world. Just wake up in the morning, if you get a bad thought, knock it out your head, keep doing what you're doing, because the more you obsess over it and the more it ticks over your head and you think about it and think about it and think about it, it's just going to do your head in more. But that's my personal opinion of it. But this CBT, it could be good for some people. Some people might find, like you for example, you might find it a lot easier to do CBT, and it could really help you, it could, but I will be honest, I don't think it would help me. I think me doing what I'm doing, as I've got this channel to concentrate on, that's enough for me. I mean, even if you're not into something you were into, I don't know, a few weeks ago, a few months ago, However long ago you're into it, you might find you'll be into that again. And I'm not going to say obsess over it, but just do it. Make it a regular, make it into a routine. That's a good idea. We've got here interpersonal therapy. It involves talking to a therapist about problems you're experiencing. It says here it aims to identify problems in your relationships with family, friends or partners and how they might relate to your feelings of depression. Treatment also usually lasts 3 to 4 months. Now, you could try that, but in my opinion, if you haven't got it as bad as some people have got it, you may not need all this. You might just need to be put on the right medication. Maybe, a counselling session once every couple of weeks, once a month, once a week, I don't know. But sometimes tablets, they're magic. They can make you feel so much better. Like here, they've got antidepressants, maybe recommend if you have moderate or severe depression and don't want to try psychological treatment, or psychological treatment doesn't help. If it doesn't help, don't worry. You're absolutely fine. But they may also be used if you have mild postnatal depression and previous history of depression, because you guys out there, if any of you already got depression, you might end up with this. You're not abnormal. You're just a mum that's struggling a little bit. And also, like I said, if you want to chat, I'm willing to talk to you about it. Or there's other, there's people out there that there's support groups. Like here it says charities and support groups. I'm thinking of signing up to a support group. I think it would be good for me as well. It says here, antidepressants work by balancing mood-altering chemicals in your brain. So, in other words, instead of your brain being like that, it's going to be like that. They can help ease symptoms such as a low mood, irritability, like I talked about in my video, my last one, lack of concentration, and sleeplessness. Now, I don't get sleeplessness. I'm one of them lucky people out there. Allowing you to function normally and helping you cope better with your new baby. Now, everyone is not a super mum. Even if you, so I bet there's someone here watching me now that might have this. You are not a super mum, okay? Everyone has to have breaks. And if you don't have regular breaks, then it's just going to tick over and tick over. You need help. You cannot do it on your own. Antidepressant, brain fart. Antidepressants usually need to be taken for at least a week before the benefit starts to be felt. So it is normal, that says important, see? But get over it, word blank. So it's important to keep taking them even if you don't notice an improvement straight away. That's what I will say from my experience. Tablets can take a while to get into your system properly, but if you ever get a down day and you think, oh, I can't handle this, just wait, okay? Wait until they get in your system. You'll usually take... and if you stop them too early, and this is a warning out there to you lot, I tried stopping all of my medication and it completely fired back at me the wrong way. And don't ever do that. You need to take regular medication, okay, for this, because it's important. Because if you don't, and you don't want your baby to suffer, you don't want your family to suffer, because you will get stressed and things like that. That's for severe postnatal depression. You will get stressed, etc. You need to take these tablets to make you better, okay? So literally, if you're breastfeeding, obviously you need to talk to your doctor about medicines, as not all antidepressants are safe to take while breastfeeding. And I'm going to read out some side effects. You may feel sick. Not got that, touch wood. You might get a bit of blurred vision, dry mouth, one of the constipation for the nation, you might get a bit of that. Dizziness, you might feel a bit dizzy, or you might feel agitated or shaky. Now, I felt a little bit agitated, I'm not going to lie, and a bit shaky, but shaking Stevens. These side effects should pass once your body gets used to the medication, okay? So hang in there, you'll be alright. We've got severe postnatal depression and you don't respond to treatments above, you'll probably be referred to a specialist mental health team. Your team will be able to try additional treatments such as more intensive CBT, other psychological treatments such as psychotherapy, therapies such as baby massage to help you bond better with your baby if this has become a problem. Basically, in short terms, just contact with your baby, and this is an opinion just from me. Put your baby skin to skin on you. Believe it or not, just doing a bit of skin to skin with your baby, it's good. It'll help. You've got different medications. What they'll do, they'll just basically try you with one medication. If that don't work, they'll put you on another medication, and if that don't work, they'll just keep swapping medication till they find the right one for you. Electroconvulsive therapy, don't worry, even if you have got severe depression, this is the last final thing they'll offer, but you're fine. Tablets, they should be fine. It's basically where electrodes are placed on your head and pulse of electricity is sent through the brain, which may improve your mood by changing the balance of chemicals in your brain. Try to ignore that one because it's not, you'll only have that if you've got it to the point of where, I don't like saying it, but if it's to the point where you want to kill your baby or anything like that, and that'll be last, okay? So try not to worry too much about it. If it's thoughts that your depression is so severe that you're at risk of harming yourself or others, you may be admitted into hospital or a mental health clinic. Now, I agree with that part. Go and get treated there, because you don't want to hurt yourself and you don't want to hurt your baby, because we know, between me and you know that you don't want to do that, because do you want to see your baby grow up without a mum? Do you want to see your partner grow up without the love of his or her life? No. So please, if you feel like hurting yourself or hurting your baby, get help, because they can help. Believe it or not, they'll help you. And just another little tip is watch regular videos about postnatal depression. That would be a good thing. And I'm just going to read out charities and support groups. We've got Association for Postnatal Illnesses, APN, helpline on 0207 386 0868, 10 AM to 2 PM, Monday to Friday, or email at info@apni.org. I sound like a robot. Right, we've got pre and postnatal depression advice and support, Pandas, and the helpline is on 0843 2898 401, 9 AM till 8 PM, Monday to Sunday. I sound like someone off the TV. National Childbirth Trust, NCT, helpline on 0300 330 0700, 8 AM to midnight, Monday to Saturday. Or we've got Mind, the mental health charity info line on 0300 123 3393, 9 AM to 6 PM, Monday to Friday. Or email at info@mind.org.uk. Or you can also search for your local support groups and find details of national telephone or email support lines on the Maternal Mental Health Alliance website. Sorry guys, another tip, try to make light of it, because look at me, I've got postnatal depression and I don't care. Stuff it, Right, I'm going to have a cup of tea and I'm going to have a fag. And my next video, I want to say, give me some ideas. What could I do my next video about? Anything you guys want to talk about? Literally anything. I'm random if you want to talk about some jelly beans. Right, we've got caramel popcorn, sour lemon, pear butterscotch, cranberry and apple, Hawaiian pineapple and mint sorbet. Now seriously, anything you want to chat about, if you want me to do a review on something, if there's anything I need to improve on, just let me know, alright? But obviously I mainly want this channel to be about mental health, because I believe that I can help everyone, and I believe I can help you, whoever's watching. If you've got something you want to talk about, just comment and we'll have a chat about it, alright? But for now, I'm going to go. But thank you so much for listening and hearing what I've had to say. I really do appreciate it. So please like, share and subscribe. It would mean so much to me, because I just want to get this channel out there. It gives me something to do. It helps me get over my postnatal depression. But again, thank you so much for watching. Peace out.